joining us in studio this morning, and he does this on Wednesday mornings. Sometimes we actually see one of the physician assistants drop by, or sometimes some other medical professionals too. The idea is to give you a wide variety and views of modern medicine in this country, as well as in Twin Falls. Dr. Jonathan Tripp with us with Better Health this morning on News Radio 1310 KLIX and newsradio1310.com. And of course, Bill Colley answering the telephones. And, this is probably one of the best half hours I have all week. I just get to sit back and listen.
I think it's one of the most fun.
Yeah, I do too.
People they will tell me that they've heard me on the radio, and so I usually reply with something like, "Well, I'm now semi-famous, but not really famous." But my response is, "The show is a lot of fun," and because we get to talk about a variety of topics, they are things that I talk about in the office a lot. But the truth is this is meant to be a show where we give, as you say, a broad range of topics. Some have interest to everybody, and some are a little more specific. So if we're talking about prostates, it's a more narrow crowd. Excuse me. But this morning we're talking about how to recover your skin, especially after we're pretty much through the summer. Although this week's weather, you would think we're still in summer.
Yeah, this can cover, as you point out, this can cover so many different what they call demographics, because kids are out a lot in summer. People who are farming are out a lot in summer. People who are doing road work are out a lot in summer. And anybody else who just likes to go fishing or be out, swimming and things like that. You've got people from, age 1 all the way up to 100 who are probably, dealing with a lot of sun exposure.
Yeah, in fact, not to admit too much about my age, but I've got a couple of precancers that are on my face right now, and nobody knows that unless they know what they're looking for.
Mm-hmm.
But they're just little flaky skin that, if you peel them off, about 2 weeks later, the same spot shows up again. And that's a big hint that you got a precancer that has the potential to turn into squamous cell cancer. Easy to get rid of. It's something that we use liquid nitrogen usually just to freeze off. It's very superficial, but, if you let it go a long time, it can become a big bad ugly, and then we got to start talking about cutting on your face and on your arms. And these are things that we take care of every day in the office, something all of my practitioners are very familiar with. And I say all because we're growing. We've had Russell Singleton, who's been there almost from the beginning. He's been on the show. We have a new nurse practitioner, Crystal King, and she's there part-time. And we'll have, by the end of October, a very nicely experienced full-time physician assistant named Jeremy Daly. So if Jeremy ever gets to hear this show, he's in El Paso, Texas right now, but he'll be semi-famous as well. But very, very sharp people, all of them. In fact, we have some fun joking about, who's better looking, who's smarter, who has more hair, so it's everybody would be a good choice to see in our office. But today we're trying to hit, how do I take care of my skin now that I've done some damage, or how do I just look better? And so let me give a quick background on me. For about 5 years in the not San Antonio, that was where I started, but in the Phoenix area, my practice was 100% cosmetics. And so we did what I call foo-foo medicine, where we did Botox and laser hair removal and spider veins and fillers, along with chemical peels. And although I don't have the lasers, we still do quite a bit of that in our office, and we've never advertised it. And yet it grows by word of mouth. I had lady come in Monday this week and say, we got to get a group together for Botox. And I said, well, get the group together, we'll do it. So that's some of the fun things we do. But chemical peels have kind of a 2-for-1 effect, and I've been thinking about doing that on myself. Should I do the chemical peels, which don't really peel your skin, at least what we do in our office, but could get rid of these precancers in a more, shall we say, cosmetically appealing way? Or do I do what I do most days on other patients, and that is just freeze the little guys that I know are there and be done with it? And the answer is either one works, but one of them has a little more fun to it and take 3 or 5 years off of your face. So that's some of the fun, but we want to talk about some of the skin structures, some of the damage, cancers to worry about, and would entertain any callers that have experiences with skin conditions, skin cancer. Tell us your stories. We'd love to have that.
And a lot of people have had who've suffered through acne and the like have had these peels done too, and they get quite a bit of improvement, I understand.
Yeah, with acne, there is really no cure except for one medicine called Accutane, and it works 2/3 of the time. So, and it's a tough medicine. It has a lot of legal issues to it, a lot of side effects. I don't even prescribe that one because I have such effective other choices. And if I can get your acne to where it is well maintained, livable, likable, so to speak, not that you'll ever like acne, then I've avoided a more serious medicine. And often I try to avoid using any long term antibiotics, if at all, because that can set you up for resistance. At least your bacteria can become resistant to antibiotics, and that sets you up for trouble later in life. But the truth is, the standard dermatologist's answer for a kid with acne is, here's retin A and here's minocycline, an antibiotic, and you'll just take this every day until you get through adolescence. And then what do you do when you turn 30 and you got acne again? You start over? Well, I've got some other alternatives that I like real well, but the scarring can be improved with peels. The only thing that actually will remove scars is what's called a CO2 laser, which I do not do. That would be truly plastic surgeon. And that has a 3 month recovery, so not a lot of people want to go through that.
Sure. We've got more coming up with Dr. Jonathan Tripp, joining us this morning with Better Health from Tripp Family Medicine. He's located right here in Twin Falls. He'll give you the contact information in a few minutes. And of course, you can reach us following the other side of the break, 736-0300. If you have a question or comment for the doctor this morning, it's 55. Quick warm up today and 20 minutes away from 9 o'clock. Our studio guest is Dr. Jonathan Tripp. I can't talk this morning, doctor. I think I need an appointment.
That's right.
We'll
Sorry,
let you
we're
do.
too busy for you.
We'll let you do most of the talking. Right. And the doctor joins us on Wednesday mornings between 8:30 and 9 o'clock. Better Health with Tripp Family Medicine, right here on Top Story with Bill Colley on News Radio 1310 KLIX, as well as you can listen to us anywhere online all over the world, newsradio1310.com. You were sharing a story off air about sometimes people, women especially, getting acne at a certain age, and it just comes about all of a sudden when they sometimes never have had it before.
Yeah, my early experience before I did completely cosmetics, I was already doing chemical peels with just the intent of some cosmetic emphasis, making things look a little better, what I call cleanup. And I would routinely get, and it's funny, it's age 33, just seemed to be the classic age where I would have a patient come in and say, I've never had acne, and now all of a sudden I have this around, the angle of my jaw, so back by the ears, underneath my chin. Where did this come from? And the answer is there is hormonal changes, but at the same time, if I do blood work to say, hey, where are your hormones, it'll be in the normal range because the normal range is so broad. But guaranteed there's changes with testosterone, estrogen, progesterone during that time frame. And so if they had acne as a teenager and then it went away mostly through their 20s and shows up again, that's one that we commonly treat with a daily kit that has an emphasis on glycolic acid, and then similar peels with either salicylic or glycolic acid really make a difference for cleaning that up, making life a lot more acceptable from a cosmetic point of view. A lot of the complaints that we get really are ranging from acne to, hey, I've got this new dark spot or dark area on my face. There's a term called melasma. A lot of people will talk about the mask of pregnancy. That's a very difficult one to treat, but things that we can improve. I wouldn't tell you that there's really a cure, and I've had lots of products or treatments that promise a cure, and really there's not a lot of evidence to support those. But um, so those are some of the things that really, look, new skin lesions, of course, are always a concern for cancers or precancers. I'd absolutely tell you, come get those checked out. And it's easy enough to say, hey, that's not a worry. And sometimes the things you don't worry about but are new are the problem. I have a gentleman I saw yesterday. He's got spots all over him, all kinds of dark colors. None of them are a problem. And I found a 2 millimeter spot on his back that is black, flat, and brand new. Well, he doesn't know if it's new or not, but pretty much new. And that's a threat for melanoma. And it's teeny. So it is the kind of thing that unless you know what you're looking for, a lot of times you'd say, well, it's too small to be a concern. But in his case, that's the only one on his whole body that's a concern.
846, and we have a caller with us. You're live on the air with the doctor.
Hi. I have a question about skin tags. My The ones that just kind of all of a sudden start growing.
Yep.
Is there anything that needs to be concerned about those, and how do you get rid of them?
If they're true skin tags,
Yeah.
um, they are not ever a health threat. They are annoying. They're terribly annoying. They catch on collars and on chains and under your arms or wherever they are. They're usually in creases like the underarms, the groin, but especially around the neck is where most people have trouble with them. Getting rid of those, I can't tell you there's a cream or a prescription to take by mouth, but they are removable by several means. The most common is either freezing them with the liquid nitrogen, where they fall off about 2 weeks later. There's also actually cutting them off, and it ranges. I'll have some people that I numb every spot with a little shot, and then we cut that off, and that heals up in a week's time. You can't hardly tell where it was. And I've had one super brave lady in my first practice in Texas that came in with a whole bunch under her chin. And she says, "Can't you just take, a razor and just shave all these off?" And I'd never done that before. I'd actually never even cut one off without numbing it before her. And so I learned that sometimes the shot hurts just as much as cutting it off. But I wouldn't tell you go get a pair of fingernail clippers and go after them, because then you'll get to see me about infection. But yeah, they are removable. And what's really interesting is your insurance will pay to get rid of these, even though they're benign. Many benign skin lesions, they won't touch. You have to pay out of pocket. But most insurances will actually cover getting rid of skin tags. So happy to see you for that.
Okay, thank you.
Want to thank her very much for the telephone call. And of course, I had one of those come up one time, and it turned out I just changed the belt I was wearing, and that had been the cause of it. And of course, it's funny. Sometimes it can be just a particular piece of clothing, something like that, that causes them.
Huh. No, I mostly see them kind of spontaneously, and it's hard to say whether they're truly hereditary. There is a hereditary component, but a lot of times, you never had them before, and now they start showing up. They do tend to show up more with people that are overweight, but I see them on skinny people all the time, so it's not a cause and effect directly.
We were talking during the break as well about sun exposure and how men and women have sun exposure in different places
Yeah,
because of just the nature of what they do, I guess, when they're out in the sun.
yeah. Most of our precancers and skin cancer type concerns really start with where we are when we're little kids, and by our cultural traditions, our girls have longer hair, and they usually do that through at least their teenage years and often into their 20s before they get sick and tired of taking care of long hair and fielding two or three kids and running everywhere and don't have time to primp in front of that mirror anymore. And so, but the guys traditionally have shorter hair, ears exposed, and so as we talk about precancer or sun damaged areas, really the higher forehead uh, for the guys, and the ears are a big deal. Where for the women, it really starts at about the eyebrows down, nose for everybody, and hands and forearms are a big part of this. And what's interesting is, especially if you stay with a population that's 50 plus, guys will tend to have their left arm is the worst sun exposure compared to the right arm, because it's their driving arm, the one that always hung out the window while you're driving. And the women traditionally were the passengers, so they either have a right arm or neither of the arms are worse than the other. And so those are some just kind of interesting changes, but it has more to do with our cultural and our raising of how our hair is and things like that. But same sun exposure causes the same trouble. Our famous farmer tan, we got plenty of those, whether you're a farmer or not. Your face and your neck, and especially the back of your neck, are frequently burned, and you get the arms, tan or burned up to where your shirt sleeves are, and you're bright white underneath the rest of that. You know, if you look at that bright white skin at age 50 compared to what's on your hands or your face, your chest and belly look pretty good.
Now, I had a bad sunburn probably going back about almost 15 years ago. I took my daughter to a parade, and I didn't realize after being in the parade route for 3 hours and forgetting to put sunblock on, didn't bother her because she has some Mediterranean ancestry on her mother's side of the family, so she could be out in the sun and never seem to even, really burn. But as we were leaving, I could feel my face, and it was sore, and it was red, and I stopped on the way out of town ran into a drugstore, bought some aloe gel, and completely rubbed it all over my face. Could feel that sensation, that tingling right away. And as it turned out, by the time I got home, it felt much better. And I put a second application on, and by the next morning, I didn't seem to have any serious issues and never had any peeling afterward.
That's a great story. Aloe is wonderful for burns, whether it's a sunburn or, you burn yourself on the stove. It is a great first day, second day treatment. Now, why you didn't peel, I'm not quite sure, but at least the aloe was a help. But a big part of if you know you've been burned, kind of like that scenario, you've been out, you forgot to put sunblock on, the sooner you can cool your face, and the aloe gel probably helped with that, but the sooner you can cool your face with water, with ice, whatever, the the more shallow the burn remains. Even though you have superficial burning still, that cooling will help. That's an immediate recovery kind of process. Let
For,
me
well, go ahead. Sorry,
uh,
don't mean to interrupt.
I was going to tell you, let me tell you a little bit about skin, its structure, and there's various ways to look at it because the skin really has many layers. But if we talk about it in general terms of two main layers of the top part of the skin being the epidermis and then the dermis being the lower part, let me just describe that. The lower part is your foundation. It really is a matrix. It's a combination of collagen, elastin, and a type of cells called fibroblasts. They're the same cells that make your scar tissue. And so these are real strength promoting foundational parts of the skin. With sun damage, with time, that dermal layer thins, and so we get thinner skin, has more wrinkles. In fact, if you look at the back of your hands, your arms, if you're over 50, you probably can raise your fingers and see some little wrinkles that weren't there when you were 30. Um, but that layer can be thickened again by low-grade irritation, which is part of the treatments that go on with skin rejuvenation, whether it's on your face, your arms. I have patients that have skin tears that, most doctors will say, I have nothing for you. And what I found is if I use the same products I use for our cosmetic skin rejuvenation is in about 6 weeks, I can get them to where they don't have skin tears anymore. I have a gentleman I saw yesterday or Monday, and he actually had a cut from catching it on a camp stove just hours before I saw him. But he'd been using this for about 6 weeks, and the glycolic acid had made enough change that he had a puncture wound instead of a full tear on the arm, which he'd have had easily in the past. So we can do some things to thicken the skin, but when we talk about colors, the colors actually start right at that junction where the dermis, the lower layer, ends and the epidermis starts. And so your cells create a column of cells, and the new cell is right at that middle of the two layers and then pushes the next one up. So your whole skin is made up of columns of skin cells that actually start right at that junction. Now, if we have colors that we don't like or new colors, even a freckle, that color starts right at that dermis epidermis junction. And just by simply exfoliating some on the top, whether it's scrubs or chemical exfoliation, whatnot, you can lighten those darker colors. So many times we'll have someone come in and they have large patches on their face of darker colors that they say, I never had this. When I was pregnant, this showed up, or, after I had a bad sunburn, this showed up. And often we can lighten that to a large degree just by simply thinning the top layer of the skin while we're at the same time thickening the bottom so that skin looks younger, less colored. The color tones are more even. And on top of that, we can treat a lot of these precancers because they're so superficial. So you get kind of a two for one when we do chemical peel type treatments. Both you look better, but you're also treating the superficial precancers.
For people who'd like to get in touch with the office, how do they go about doing that?
Well, our phone number is 208 933 4400. So that's 208 933 4400. And our website is tripfamilymedicine.com. And our Facebook page, you can find us at Trip Family Medicine. So any of those ways you can reach us. And, if you have questions, you'd like to get a spot checked out, we'd be happy to see you. And like I say, any of the practitioners at our office would be very skilled at the skin conditions.
I'll throw one at you. We've got about a 2 minute window here. Since I've been a little boy, as long as I can remember, I've had a little a brown dot on my stomach. Looks like a freckle. Looks like someone took a brown marker and just sort of pushed it down there.
Okay.
It's never gotten any larger, never any smaller. Still there after 50 some years, and I've always been perplexed as to how that thing just keeps that color and never has changed.
Never changed. Well, the good news is it hasn't changed. And that is one of our big worries is when things change, even if they've been there 50 years, if they start changing, it's probably time to at least take a look and maybe get rid of it. But how does that do that? Well, it was a permanent marker, so it's staying.
Yes,
Yeah.
yes.
That's
A Sharpie.
it should stay the same. That's the key. We'll have some things that show up in puberty or even later in life, but the real key is if they aren't changing, most of the time they're benign. They're not a worry. But things that are growing, changing color, changing shape, or have additional colors showing up, those are all skin lesions for us to take a look at.
I was going to say it's kind of like a birthmark. Some of these things just stay with you and really don't go away, or what they used to call wine stains.
Yes. No, and I have one of those, a little one on the back of my hand. So, yeah, port wine stain, that's exactly what they're called.
Want to thank you for coming by, Dr. Jonathan Tripp, in studio with us this half hour. Who do we see next week? Are you back, or are you sending someone else?
You know what? I think we're going to try to get Russell to come in, and because he's a better expert. He's
just asking.
Russell has been awesome, and you'll love him because he's such an academic pusher. He's awesome.
All right. Coming up, by the way, we've got a guest talking about some city issues with us here on Twin Falls. That's on the way in just a few minutes. You're listening to Top Story on News Radio 1310 KLIX and NewsRadio1310.com. Bill Colley with you until 10 o'clock this morning. Fox News, though, is straight ahead.